First, I want to show our viewers a tweet that's been getting a lot of attention. Now, this is from a woman who tweeted, "I received an email from my rheumatologist today that they are stopping all refills of methotrexate because it's considered an abortifacient. Methotrexate is a form of chemotherapy, but in reduced quantities, it can be taken long-term to help with many autoimmune diseases."
It's absolutely devastating as a doctor, Eric. This is going to have vast consequences that we don't even understand yet. Methotrexate is an immunosuppressive medication. We use it for inflammatory conditions like lupus, rheumatoid arthritis, psoriasis, leukemia, breast cancer, and lymphoma. In high doses, it can also be used for abortions, such as ectopic pregnancies. Women of childbearing age, even if they are not pregnant, are not getting this important and life-saving medication for their chronic illnesses because doctors are concerned about the legal ramifications, not the medical ramifications. These clinicians are practicing defensive medicine, which is unfortunately a consequence of this era. Doctors and the entire medical community is up in arms about this. We know that the American College of Rheumatology and 75 other medical institutions have spoken out against this ruling.
Now, we've heard the Biden administration, considering or saying basically that the hospitals must provide abortions in emergency situations, even in states that have banned the procedure. I understand that's all still in the works.
This is based on EMTALA, and it's an act that was passed in 1985. So this is not new. This is just a reminder of what already exists. It's part of federal law. In certain cases, it is very clear cut. And EMTALA does help. So in patients who are critically ill or unstable, who come to the ER, they can get life-saving abortion. But what about the vast majority of people who don't fall into this category? And what constitutes an emergency? Is rape or incest considered an emergency by EMTALA? And who is to make those determinations? That is the big picture here.
How dangerous is it when you have these, I don't want to call it competing languages, but people are considering different things all while there are real people out there who need this kind of care?
Absolutely, Eric. It is dangerous. Doctors and hospitals serve patients, and we always function in the best interest of the patient. These legalities interfere with our standard of care and the way medicine should be practiced. This is a good first step in EMTALA and reminding hospitals around the country that this law exists and has since 1985. But we need broad, comprehensive coverage to cover all procedures, even if they are not in the EMTALA umbrella. There is a wide variety of things that can happen to women, or if a pregnancy is unintended and unwanted, we also need to have access to abortion.
Dr. Aditi Nerurkar, thank you as always for coming on and providing your expertise and your insight here on LX News.
Thanks for having me, Eric.